All right. Good morning, everyone, and welcome to today's Telemedicine Echo. My name is Beth Munson, and I am the coordinator for this Echo. I work for Missouri Telehealth Network and Show Me Echo at the University of Missouri in Columbia. I am now going to turn this over to today's facilitator, and that's Rachel Mutro. Hi, Rachel.
Hi, Beth. Thank you. Welcome, everyone. I am moderating today because, unfortunately, Janine, who had been our moderator for, I guess, the whole past year, haven't we been doing this for almost a year? Has taken a position outside the University of Kansas, and so we will miss her. But today we are going to work on school-based telemedicine. But before we get started, I'd like to introduce the Hub team members. And Karen, would you like to start?
Yeah, hi everybody, Karen Edison, Senior Medical Director, Missouri Telehealth Network and Show Me Echo.
Thanks, Karen. Heather?
Good morning, everyone. My name is Heather Hagan. I'm a telehealth analyst at OSU.
Thank you. Tim?
Good morning, Tim Davis, Telehealth Manager at OSU Center for Health Sciences.
Thanks, Tim. And Robert?
Hi, I'm Robert Stiles with the Heartland Telehealth Resource Center, but work at University of Kansas School of Medicine.
Perfect, thanks. And I think we would like to go around and hear from all of you. I will save our two speakers until last, and then they can introduce themselves right before they get started on their presentation. Mila, would you go next?
I'm Dr. Milo Cunningham, a retired anesthesiologist interested in this concept.
Thank you so much. I'm sorry I mispronounced your name, Mila. Rachel,
Thanks.
could you go next?
Hi, I'm Rachel Buneman. I am a county engagement specialist with the University of Missouri Extension, working out of Phelps, Dent, and Crawford County.
Thanks, Rachel. Christy?
Hi, I'm from the Heartland Telehealth Resource Center and the University of Kansas Medical Center.
Thanks so much. Mafalda?
Good morning. My name is Mafalda Cannon. I am with the HCC Live Well Clinics. I do the telehealth for the Odessa School District. Thank you. Good morning, everybody.
Welcome, welcome, and thank you for joining today. Lori?
Mute.
Got it.
I'm sorry, I stepped away. I'm Lori Spar. I stepped away. I had to step away for a minute.
That's all right. That was perfect. Okay, how about Hannah?
Hi, I'm Hannah. I'm with the Health Communication Research Center.
Thank you. Stephanie?
I'm not sure that Stephanie has audio,
Okay.
Rachel.
Did she put anything in chat?
Just her name.
Okay, great. And I know Jerry Wilmus is traveling, and he's from Mosaic Life Care, Northwest Missouri State University, but he's going to leave his, stay muted and leave his video off today. Kara?
Hi, everyone. I'm getting my video set up. My name is Kara Lawler, and I'm the director at Health Communication Research Center. Really excited to be here today.
Thanks, Kara. And Jeremy?
Hi, I'm Jeremy Goins, CMIO here at Freeman Health Systems, Joplin, Missouri.
Wonderful. Thank you so much for joining today, Jeremy. And so I do have just a couple of announcements. We are going to just try to use first names, and I think most of the people on here today have been to Echoes before, so but we do try to use first names only. We try to be really careful and not share any protected health information, so please just be mindful of that. If you have a question, of course you can use the little reaction button on the Zoom, but you can also just raise your hand and wave and unmute, and we can call on you. But keep your microphone muted until you're ready to speak. And then for some people who are not able to watch this live, it's important to try to remember to say our names before we start talking again. And I think that that's probably one of the hardest things for us to remember. But if you can, try to remember to say your name when you start talking. This presentation will be available in Box after today's session. So if you need to refer to that, you can. And as always, the value in these echoes are so that we can talk about real life cases. So if you ever have a telemedicine or telehealth question, we would like you to bring that to these sessions, and so we can have an in-depth discussion. It does look like we have a few more people that I would like to have them introduce themselves. Tarek, are you there?
I am. I'm just in a parking lot right now, so forgive me for my camera not being enabled. But yeah, nice to be here. Optometrist at UMSL, working on several telehealth projects, and an honor to be with you guys. Thank you.
Thanks, Tarek. Deborah?
Hi, school nurse, St. Louis Public School.
Thank you. Welcome. And Haley? Haley might not be able to unmute at this second. Okay, we will go ahead and transition into our presentation for today. We are really thrilled to have a couple of people from CoxHealth down in the southwest part of our state talk to us today. We have Tabitha and Jill. And Tabitha has worked at CoxHealth for 5 years. She's currently the virtual visits product manager overseeing the setup of school clinics. She established the first school clinics in 2016 and has grown the program from 6 schools to more than 50 school clinic locations in Southwest Missouri. And Jill Cook is one of the school coordinators, so I'm sure we'll get to hear all about that. So welcome.
Thank you for having us. Do you want me to go ahead and share my screen, Rachel? Okay.
Yeah, please go ahead.
So I prepared just a quick overview of our school clinic program and what we offer, and then we'll be able to discuss and answer questions. Just give me just a second here. Okay, can everybody see my screen? Okay. So this is just an overview of CoxHealth School Clinic program. So when we established the school clinics, really we set forth just a few goals of what we wanted to accomplish and what we wanted to help school districts with, which was reduce absenteeism in students and staff due to health-related needs, get care to students and their staff sooner, lower the district expenses, and make our product very flexible for each district because every district is different, and we'll kind of dig into that. And then increase access to healthcare. And this is for a lot of our rural districts that don't necessarily have quick access to healthcare within their cities or their towns. They don't have rural clinics or anything like that. And so when we talk about design flexibility with our program, we have come up with something that could support a district that has 50 school buildings or a district that just has 1 school building. And by doing our program with telemedicine, it allows us to support a district of any size. And so we really pride ourselves in being able to be flexible for a district. And so you'll see when I show you some of the school districts that we do have, that we support districts that have as few as 150 students, K through 12. And then we have districts that have over 12,000 students, K through 12. So we can really meet everyone's needs. And so these numbers I'm going to show you here with the permission of the school districts. This is the results from the 2020 school year because we have not finalized 21-22 school year. And I use Nixa as one of our larger school districts. And you will see here the number of student visits that were done, staff visits that were done, and then also staff dependents, because that's a really good service area that we service. And then the percent of those visits that were able to stay in school. And the reason we also include staff visits in this is because the districts, it's very important to them that teachers are able to stay in the classroom because students learn better from that teacher than having to bring in a substitute teacher. And so we focused a lot in Nixa on trying to keep the staff in school at first so that they can provide a better education for the students. And so you'll see that 90% of them were able to stay at work. And this just means that they weren't contagious. They needed a minor illness checked out. We also have partnered with Nixa School District and a pharmacy so that when our providers treat these patients that they e-prescribe, and a local pharmacy in Nixa will deliver that prescription right to the school for them. That way it saves them more time from having to be off of work. And I'll pause there and go on to Monette. Monette is a smaller school district. So I did want to go ahead and just show you some data from them as well, where 61.9% of their students was able to stay in school and 85.4% of their staff and dependents were able to stay at school. This dependent piece is a pretty big deal as well, because if the staff member isn't sick themselves, it sometimes is their child who even goes to that district as well. So being able to treat the staff's dependents allows us to help keep them in work as well. So I want to pause there and just see if anybody has any questions about the data that I shared for Nixa and Monette. Okay, and then I do want to go ahead and give Jill a moment to speak here. Jill is one of our CoxHealth coordinators at the school district in Mount Vernon, Missouri. So Jill's role really is to help conduct the visits while at school. So I want to have her talk to and give some examples of how having that school clinic there in Mount Vernon has impacted that district. So Jill, I'll let you talk.
Sure. So currently I have 4, and I know Tabitha will show you later on, we call them our cards in the elementary, middle school, intermediate, and high school. And I just travel around to those different schools when the nurse will call me and say, or a teacher will just reach out to me and say they need a visit. And it's just been a very rewarding program for our teachers, for our students. Probably the thing that impacted me the most was a student, and something that I learned is that, there's a lot of students that fall through the gap that are not on Medicaid. Their families just really can't afford to take them. So we are lucky to have a Children's Miracle Network that will pay for students who cannot pay for a visit. And I will always remember a middle school special needs student who had a horribly abscessed tooth. And our middle school nurse just would not give up on the student being seen. And even today, that was about 3 years ago, when I see him, he will remind me and actually show me that tooth and tell me how much better he felt after doing that visit. And that really, it made a big impact on me for something I take for granted for myself and my child, that some children don't, they're living in pain. And I don't know, that really impacted me. As far as the teachers go, they love being able, a lot of times we can get them in and out in 20, 30 minutes, especially if I know they're coming. We also we have in Mount Vernon pharmacies that deliver. So it's just been a really good impact for our schools.
Thank you, Jill. I appreciate that. Does anyone have any questions for Jill before we go on?
I do. I put it in chat, but I'm just going to say it. So I really love the information about having Children's Miracle Network fund for uninsured patient visits. Do you also, Tabitha or Jill, have staff to help the family check for Medicaid eligibility and get them signed up if they are eligible?
We do. Oh,
Yes.
Go ahead, Jill, sorry.
Yeah, I always know that is something. Now, I will say this past year, our school administration worked with the CARES Act money. And we were lucky that our county commissioners, they used some of that money that the counties got. And they actually paid for all of our students and staff to have free visits this year with COVID. So this has been a wonderful year where no one's had to pay. But yes, I know before COVID hit, that was something that Cox has someone that helps the families get registered for Medicaid.
So at CoxHealth, we do partner with Children's Miracle Network at CoxHealth to help support all of our school districts. And I'll just leave this up here of some of the ones we support right now. But with Children's Miracle Network, they will cover the visits of students who are uninsured right now. And we'll cover the first visit at no cost to them. And then we partner with the parents to try to get them enrolled in Medicaid or to find them resources. We also partner with our CoxHealth info line. So if we see a student or a staff member that has not established care with a primary care provider, we will help them locate one and get a visit scheduled with a primary care provider. That way they can follow up with them on any needs that they may have. And this right here is just a current list of our participating districts. I will say this list expands every year. We are to the point now, when we first started establishing these school clinics, we relied on a lot of grant funds. So for our first 6 districts, we had funds from the Missouri Foundation of Health to establish the school clinics. And then from there, we used the USDA and distance learning and telemedicine grant to help purchase all of the equipment for the schools. But currently, based on the data that we were able to get and the reduced cost of savings for the school district on staff absenteeism and student absenteeism, a lot of our newer districts that we are bringing on are paying for the program themselves. So we create the model here at CoxHealth, and then the school district reimburses us for the cost of that model every year. A lot of them have received grant funds, like Jill mentioned. Mount Vernon used CARE Act funds to fund their school clinic this year and offer a purchase up program where they paid for unlimited visits for staff, students, and dependents this year. And so some of our districts will come to us and say, hey, we got this grant fund, can we pay to have unlimited visits for our staff and our students? And we will accommodate that. That's part of the flexibility of our program. I will share some numbers here with you. I do not have 2021 school data finalized yet, but this will be the number of visits and the average patients that were able to stay in school, faculty, staff, and students from 2016 to 2019. And you'll see how our numbers have gradually went up just as we add more schools and the school districts become aware of the program. We do spend a lot of time at the beginning of the school year really promoting those school clinics. So we do back to school events where we have the car, the equipment, and the school coordinator on site to meet with parents, show them the equipment, show them what we do. We never, and at CoxHealth, we never treat students without a parent present. And so that's really big for us. And how we do that is, since it is telemedicine and it's virtually, we can text or email a parent a link to join the visit right from work or home. So if that kiddo is not contagious and they're not going to have to go home anyway, we bring the parent on virtually so that they can take part in the visit. They don't feel like we're treating their child without them present or doing anything that they wouldn't want us to do. We also allow them to come and take part of the visit in person if the child's contagious and needs to go home anyway. So here are a few of the services that we do provide. So our basic care is just anything from minor coughs and colds. We do hold a CLIA license for all of our schools. So we are allowed to do, and we do frequently, on-site rapid strep screenings. So all of our coordinators are trained to be able to provide that rapid strep test. We do offer Tele speech therapy to school districts, which is a great service, especially for rural districts who cannot afford to employ a speech language pathologist full time. We do virtual speech therapy with our speech therapists here at Cox, which has gone over really well with a lot of our school districts. We have asthma care as well. So we partner with an asthma specialist here at CoxHealth, and she will connect virtually to do asthma care follow-ups and help students who have asthma kind of establish care with her. She is also wonderful at using our telemedicine setup and our platform to educate school nurses and teachers about asthma triggers within the school district. So she'll hold seminars and webinars right around back to school season to kind of train the nurses and the staff about things that could trigger their students with asthma and things to remove from the school district, like Scentsy warmers or leaving buses running in front of the schools for long periods of time, because that can really trigger asthma students. We launched a behavioral health program in partnership with Burl. So we use that with our telemedicine platform. We also do occupational medicine for the school districts, all with our telemedicine platform. So if they have a teacher or a staff member that gets injured at work, they can put them on camera to do an OcMed visit with one of our occupational medicine. And then our prescription assistance is also funded by Children's Miracle Network. So again, if we have any uninsured students that need to do a visit, we cover that, and then we cover any prescriptions that they need with that funding as well. So those are some services we provide. And then some of the illnesses that you'll see that we treat, we have a scope of care that all of our providers have. And I always like to point this one out. We get asked about it, about lice. And the reason we treat lice in students in some of the school districts is because you will have your repeat offenders that just have lice and they cannot get rid of it due to their home environment or parents not doing what's needed. And if you treat lice via telemedicine, then you can get a prescription strength lice treatment that's covered by Medicaid. And that really removes any barriers from the parents for getting that treatment, because we can prescribe it, the pharmacy can deliver it, and we can send it home with the student. So that's one of the reasons we treat lice. And then I just wanted to show you guys some of the equipment we use. So this right here is called our GEDMed horoscope. We love this thing. We've been using it since we established school clinics back in 2016. But this allows us to get a live projected view to the provider on the other end. So it comes with an otoscope attachment and a general view lens. That otoscope attachment we use to look in the ears. We can look in the throats, up the nose, to get a live view, and the provider will see. This is also good for mom or dad as well, because if mom and dad are on camera or in the room, they're going to see exactly what the provider's seeing. And this allows the provider to say, hey, you see right there where their ear is red, that's irritated, this is what we need to treat. And the parents really love that. They feel like they're part of the treatment and they're getting to see what the provider sees for the first time ever sometimes. And then our general view lens, we really use to get close-ups of bug bites, rashes. We treat athlete's foot, some toe things, again, to look in the mouth, down the throat, those types of things. And then you'll see here, we have a digital stethoscope. So it projects live heart and lung sounds. Our providers will use this. Our asthma provider does use this tool a lot. It's one of the main ones she uses to listen to heart and lung sounds for asthma visits. And then we have two different setups we do for districts. We have a cart, which you'll see right here, and this is one we've built ourselves. But this cart stands about, I want to say 5 feet tall, goes up and down, lowers. So it can be placed in a closet. Sometimes space is really limited in school districts, so we try to be as flexible as possible. And in the last couple of years, we have implemented our backpack kit, which is just all of our telemedicine equipment put into a backpack so that it can be travel versatile. We can treat people in conference rooms or in empty classrooms to really be flexible for the district. So that's a little bit about the equipment. And I'm going to go ahead and end my slideshow here and stop sharing. And then Jill and I are happy to answer any questions you guys have about our program or how we help the districts.
Congratulations, that's an amazing program. It looks like we might have a couple questions.
Yeah.
Rachel, did you have a question?
So Tabitha and Jill, I'm a community health educator, and Salem and St. James are in my region. I was just wondering if you could share anything about how implementation's going, or if you're encountering any barriers for those districts.
Yeah, so Salem and St. James, we were able to set up due to funds from the TKD Foundation out of Rolla, and they are in their second year. And so implementation went very well in both of those school districts. They're very excited to have the program. A couple barriers we ran into was hiring staff. Since they're smaller towns, it did take us a little bit, but we got some great coordinators in there now that are helping conduct the visits. Their grant funds do run out at the end of this year to cover the cost of their coordinator. So we're just looking for, working with the districts right now to see if they want to pick up that cost and how we'll work that. But as far as visits go, it's going really well out there in St. James and Salem both.
Thank you.
That's exciting. Who else has questions?
This is Jeremy Goins from Freeman Health. I have a few questions, mostly surrounded around how successful you all have been. We're trying to set up in our area, and we found that really school nursing participation is really where the barrier is. We can't get the school to initiate the call. We can't drive adoption. Outside of that very first where the first of the school where you're going out and talking to them, what else are you doing to drive nursing participation?
So when we first established the school clinics, we discovered that you have to start with the nurses. And so if the nurses don't want the school clinic there, it will not be successful. And a lot of things people don't take into consideration is how busy the school nurses are. Some of those school nurses are going to be busier than doctors in a rural clinic. They see students for everything. And so you really can't, when you present a program to them, you can't really lean on them the most. You have to be able to have a nurse's assistant, or like we provide at CoxHealth, a navigator like Jill to conduct those visits. Because like Jill said, visits take anywhere from 20 to 30 minutes. And so in some of your rural districts, you may have one nurse for K through 12. So if you go into that school and you approach it where we'll put in a virtual school clinic, but you have to conduct those visits, and she's the only nurse for K through 12, you're not going to get anywhere with that. And so when we built our product, we really included this school clinic navigator or coordinator, which is like Jill's position, to help those school nurses out. So they conduct all telehealth visits, but also when they're not conducting telehealth visits, they can assist those school nurses with putting Band-Aids on, helping with change of clothes. They just can't dispense medication or anything like that. So I think that's what sets our program above and beyond others, is because we offer that coordinator role and we don't require the nurses to conduct the visits.
Got it. Yep.
Can I just say that on the national level, the VA tried forever and ever to get Telederm started. And then when they finally did it in 2012, that's exactly what they did, is they hired a clinical coordinator and, they hired the personnel. We've known in telehealth for a long time, you have to have that operational support to make it happen. One other thing while I have the floor, as the former chair of the Department of Dermatology at the University of Missouri, I will say that we have 3 excellent pediatric dermatologists. And whenever I see a list for school nurses that has something like dermatitis rashes, it just makes me cringe, because there's so many things that kids get on their skin that don't respond to a little topical steroid, you know what I mean? And so we do have these pediatric dermatologists that are mission-based, lovely people. And I wonder if there's some way to, and they all do telehealth, I wonder if there's some way to link your school nurses with them. There is a program called Access Derm. That's a platform, and web-based platform where we work with safety net providers to do free store and forward telederm consults. But anyway, we should talk about that, because I'm sure they're seeing things that they have no idea what they are. And it'd be easy using technology to get them that assistance.
Yeah.
I had a question. I'm sorry, my name is Kristen Goings. I'm a nurse with Lewis County C1 School District. And I had a question kind of in regards to the dermatology aspect of it. So like with the video and the equipment that you use, how well is that with the provider seeing that and to be able to diagnose and like with the cameras and stuff?
I've
Karen
had
can.
many of my providers say that it is sometimes it's so magnified that it's kind of like they love it because it really gets in there. I can adjust the lights. It's not like this. It's much more magnified. So you can really see, even checking for when we go through with lice, I mean, you can really get in there and see. So it is a very clear program. And I know a lot of times, especially with the otoscope too, the nurse practitioners have said that their view is almost better on their big screen than when they're looking through their otoscope.
And I'll just add that I did teledermatology for 26 years before I retired in 2019, all through rural Missouri. And you can actually do almost all of dermatology using technology. And the close-up's great and the high def is great, but sometimes you really need a gestalt. What you need is both. You need the big picture of where they are in the location, and then you need the close-up. But it works great.
Really great discussion so far. What other questions do we have for Tabitha and Jill?
This is Jeremy Goins again. I'm trying to take my turn and not ask too many at once. So what are you all defining as a successful visit? In other words, if you have a drop off or if you have technology fail, what do those numbers look like in terms of how many actually fail?
So I will tell you, we don't have any that failed. So we have a support team, which is called our call center hub, or what is what we call them. So if we experience any technical issues during that visit, they will jump on the call and help with getting everything reconnected to complete that visit. So we don't ever have any incomplete visits ever. We've also been doing telemedicine since 2006 as a health system. So we've really perfected and vetted every piece of technology that we use so that it's the best experience possible for the patient.
Awesome, thank you.
I will say that one of the things that is important is a wired internet connection. So in some of these school districts that are really rural, we have specified that we need a wired internet connection instead of wireless, and that really makes our visits strong. So I know at the very beginning that was something we struggled with, but making sure you have a wired connection within the districts will help with that connection.
Tabitha, I have a question about when you go into a new location. How do you, I know you go in advance to meet with school nurses, administrators, and others. What about the local primary care providers in that community? Do you have any outreach that you do with them? Or do you sometimes get pushback from them if you're coming in and trying to take that business?
So we are not taking any business from primary care providers. And so we really try to make that known anytime we go into a new place. We're just there for kind of acute illnesses. So we don't do any follow-up visits, maintenance medication prescriptions, or anything like that. It's more of, I think my child has strep throat, but we can't get in the doctor for 2 days. Can you see them? We'll do the rapid strep test, we'll prescribe the antibiotics, and then we'll say, if you're not feeling better in X number of days, please follow up with your primary care provider. So when I go into any new town or any new school district, I start with meeting with the school nurse, and then we build a program that works for them. And then we pitch it to the administration and the school board. And then once they approve it, we really put our flyers and everything out there to the primary care providers to let them know, hey, we're going to be offering this in your school. These are the services that we offer, so that they know we're not taking their place, and we'll still refer their patients back to them for any type of follow-up care.
Thank you. That's helpful.
Tariq, I see your question there in chat. Our school clinics do not offer vision screenings, but we partner with the CoxHealth Care Mobile. So any school district that has a telehealth clinic in it also has the benefit of having the Cox Care Mobile visit them on site. And the Care Mobile does hearing and vision screenings as well as all childhood immunizations. So our Care Mobile does go out to the schools to do that. Correct, Rachel, sorry. We do bill insurance. So all of our school clinics are set up as clinics. So they have their own NPI number, or not NPI number. We bill insurance for them. They're set up as clinics. It's provided by mid-levels. It's actually both. We do NPs, MDs, DOs, and PAs. So our school clinics are supported by a whole pool of providers that are located in our regional clinics, our urgent cares, and as well as so we partner, we have a, what's it called here? Where medical students do rotations here, Mizzou. I'm sorry, I'm drawing a blank of what it's called.
The rural campus. I mean, it's a,
yeah.
Yeah.
So those providers all do rotation in telemedicine while they're doing their training. So a lot of them are MDs, DO, and they will do a rotation supporting our school clinics and seeing students.
Tabitha, is Hope Masterovich part of your pool of people?
She is not. No, she stays there.
She has come to our derm echoes ever since they started 5 years ago. Like, we've trained her up to do great dermatology. So if you could get her, that would be lovely.
She is super, super busy. She stays very busy in her clinic. She did telemedicine back when, or she does telemedicine now with derm and stuff like that. But when COVID first hit, she did pick up some shifts with us to kind of help out. But Dr. Masterovich is super busy in her clinic, so she doesn't always get to support the schools like she would want.
Tabitha, I may have missed it in your list, but do you do any sort of dental care?
We do not, but we have a partnership. I've built through my network a partnership with the Ronald McDonald Tooth Truck. And so they will offer services to any of our schools as they can. So we really try to farm out things that we can't do and partner with other health systems and other entities to really support these schools. So if they come to me looking for something that I can't do, I'll find it for them. And so the Ronald McDonald Tooth Truck helps us out.
This has been really great information. Thank you so much.
Yeah.
I'm going to put Mafalda on the spot just a little bit. I know over in the Lexington area, they have a school-based telemedicine program. And Mafalda, if you're on, do you have anything you'd like to share with us about how your program is going?
Actually, our program is going very well. We did not meet with the resistance when we came in from either the principals, supervisors, or superintendent, sorry, nor the school nurse. She was aware of not taking anything away from her, but actually helping her with things that she's not able to do in her office. For instance, we had a young man that needed a tetanus shot, and then that was taken care of. But then she doesn't actually do testing for strep, UTIs, the flu, anything like that, and we can take that off of her. Our teachers, I will mention, love it. They can come in when they get a moment and say, when can you squeeze me in today? My first question to them is, when do you have free time? And so they let me know when they can get somebody to cover their class. I'm able to make a connection with a provider. I actually give them any paperwork that they might need to fill out at that time so they can get that done before they come and see me. And then they come down at the appropriate time. The physician sees them. And in a lot of cases, they're out of here in less than 30 minutes, maybe even just 20. We do whatever we need to do to see them and take care of them. Their prescription, if they need one, is called into their pharmacy, which I'm in Odessa. There's a couple pharmacies in Odessa. They can run and pick it up possibly on their lunch hour or after school and get started taking on it right away. And I don't know if all the other schools had as many issues as we did this year with COVID with substitutes. They just weren't there. And so the teachers felt horrible just leaving, knowing that they just needed rest. They were incredible. They pushed through, they did what they had to do to take care of the kids and kind of putting themselves on the back burner just because of the hardship of this lack of substitutes to help out. But it's really been awesome. They come in just with all kinds of questions. And, maybe that's not to see a physician, but I can get that physician's answer and then get back to them. And so it doesn't take off like gangbusters. You come in and you get situated and you get to know the teachers, they get to know you, you become friends. And so it's really kind of like not even going to the doctor's office. You're just going in for a visit and you're going to get taken care of. So it's just been positive for us all the way around. I can't say enough good things about it. And when the little ones come in, because I'm in the elementary building, but we have 4 schools, so any of them can come and any staff member. The little ones come in and they're so nervous. And I say, I want to tell you something that I don't do. What's that? I said, I don't give shots. Immediately they're okay because we give stickers, and so everybody's happy. So it just works out great.
That's wonderful. Thank you for that.
You're welcome.